Wobbly wheel syndrome. Everything aches, everything hurts, muscles are seizing, joints are swelling, you feel depressed, demotivated, sleepless, restless. It's almost as if your wheels are starting to fall off. Now, the most likely cause of this is basically tired glands. Adrenal fatigue is what it's often referred to. It's very common in athletes, athletes who do intense competition training, exercising in extreme conditions, high temperatures. We often refer to it as having burned our adrenals. Many athletes, including myself, have suffered this to some extent, sometimes to the extreme. Now, we see this in everyday life. People who work hard throughout their lives, perhaps having extreme stress, such as, say, the loss of a spouse, divorce, serious accidents, illnesses, problems with work, losing one's job, and so on. And just simply battling away, commuting daily, and so on. There is also a confounding factor, which is diet. There seems to be a relationship between this kind of exhaustion and being on a low-fat diet, which I think is causing widespread depletion of various vitamins and minerals, particularly the fat-soluble vitamins, and various minerals which are not in the diet in adequate amounts and not properly absorbed. Very often medications such as cholesterol-lowering drugs can have a compounding effect on this as well, and the result is the symptoms I was describing, including what people often describe as being a kind of brain fog. Now, rather than suggest a whole lot of minerals and supplements and taking this and that vitamin, I like to work on working out what each individual needs specifically. Now, the best way to get started on that is to have a read of Dr. James Wilson's book on adrenal fatigue. I think that's a very good start. And then going onto my website and completing the active elements assessment. Now, when you do that, please make sure that you fill out the additional comments at the end. I need to know what you have eaten over the last 24 hours, including what you have drunk. And I also need to know something about your personal background, your occupation, this sort of exercise history you have, and any health issues. I need to know what medication you've been taking, and so on. And then that will help me to work out in better detail what might be best for you. So the first thing to do is probably to go onto my website and get Dr. Wilson's book on adrenal fatigue. It's worth every cent. Now, so have a read of it, and at the same time complete the active elements assessment. That's all you need to do at this stage. And once you've done that, then we can go about trying to determine what might work for you. And I can assure you that if we do this methodical approach, rather than just saying take this, take that, then you will get good results. And the other thing is, you need to be patient. Okay? There's no overnight cure. These things take months, if not years. So all the best, and I look forward to assisting you.